Shakira, if you can do, oh, thank you for recording. If you can do a roll call.
Sure, give me 1 second to get this set up on Facebook.
Can you hear it?
Okay. All right. I'll just start with who I see first. Chair Hughes.
Present.
Councilmember Dukes.
Present.
Treasurer Daniels.
Sorry, present.
Councilmember Crawford.
Present.
Councilmember Winston. Okay, I don't see his audio, so I'll go back to him. Councilmember Nandi.
Present.
Councilmember Bond.
Present.
All right, it looks to be all council members who have currently joined.
Can you guys hear me now?
Councilmember Winston.
Present, yeah.
Awesome.
All right. Thank you. The agenda that Shakira had sent out, actually, she has sent.
Sorry, that's an echo. I don't know where that's coming from, but.
So what probably needs to happen is everybody probably needs to mute until speaking. There we go. So the agenda that was originally sent out, Shakira accidentally sent out the wrong one. So Shakira, can you just share the agenda so that we can adopt the meeting agenda?
Just give me 1 second here.
Okay. The one that has the roll call. Awesome. So if I can just have a motion to adopt the meeting agenda, if there are no corrections or additions.
So moved. Councilor Crawford.
Thank you. Is there a second?
Second, Daniels.
Thank you. All in favor?
Aye.
Any opposed? Any abstentions? Motion carries. Second agenda item is the consent agenda, and the only consent agenda item is the meeting minutes from February. And hopefully everybody has had a chance to review them. So if I can have a motion to approve the consent agenda item, which is the council meeting minutes from February. But prior to that, are there any corrections or additions? So hearing none, if I can have a motion to approve the consent agenda item.
So moved.
Is there a second?
I'll second. This is Bond.
All in favor?
Aye.
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 Any opposed? Any abstentions? Motion carries. We are on to the financial report. And Shakira, can you share the MFR? And also you may want to help Wayne. He's having trouble getting in. He just texted me as well. We love technology, don't we? Treasurer Daniels, you are up.
Thank you, Madam Chair. I will like to say, since I did not go over this at our executive meeting, can I refer to yeah, Shakira who did that.
Yep.
Right.
Shakira, if you're able to cover the MFR, or even Linda, either one of you all. And maybe Linda, you can go over it because I know Shakira is helping Wayne get in.
Okay, since I didn't go over it either,
It's just the unobligated that we really look at.
I have to.
I did how I mean, if you're fine, I did do like an email back and forth with Shakira, so I can go over that if that's helpful.
Yeah,
And then Linda, you can fill me in if
Yep.
I missed anything.
Yep, go right ahead.
Thank you. So the first financial record that was sent to me, there was some negative under the unobligated line, but that was changed, and so I had an email exchange with Shakira, who let me know that some funds were moved around, so that took care of the negative on there. So we didn't have any more negative on there. Those were my concerns at the beginning. Then this one was sent, so all the numbers looked good to me. Unfortunately, I was a few minutes late to the executive meeting, so I didn't have time to go over that. But those were my only concern, the negative numbers, which were taken care of.
Okay. Did you want me to go into the depth?
Yes, please, thank you.
Okay, so if you look at the unobligated amount, we still have $59,280.51 of unobligated funds that need to be expended before the end of the fiscal year. So that is before June 30th. As Alfredo said, there are no negative numbers on there. Things have been twisted around. There was an issue with a PO coming out of the wrong field before, and there was an issue with some payroll coming out of the wrong council. Those things have been resolved, and we are now back to positive accounts.
Council members have any questions in reference to the MFR report? And just as a reminder, the biggest thing that we really need to be looking at when we look at this, obviously making sure that there's, any numbers that just kind of are concerning. But the main thing that we really are looking at this stage of the game is the unobligated, because that has to be down to zero by June 30th, because this is the end of the biennium. And so we know that as of FY22, we cannot carry this over. And I know when the executive director, so when Linda does her report, you'll hear some of the things that they're looking at doing as far as expending some of those dollars. But I'm gonna open it up if there are any questions. Y'all are quiet tonight. Look, I'm hyped because I've already eaten my dinner. So we're gonna go ahead. If there are no questions, then we're gonna keep it moving. So you can stop sharing, please. Shakira, thank you. She might still be helping. Oh, there we go. And I am going to turn it over to our guest. We are excited to have Commissioner Jan Malcolm of Department of Health. And we also have Dr. Nathan Chomilo, who is our Medicaid director. And they actually came, gosh, what month was that? I can't recall when y'all were last here.
I think it was July.
Was it July? Okay, I was gonna say I knew we were still in that. And so we invited them to come back. As we know, in the African Heritage community, there is a lot of discussion around the vaccine. We are now on to 3 vaccinations that you can take. The Pfizer, you have Moderna, you also have Johnson & Johnson. And so I've asked them to come and share. I'm sure you all are probably this, but just kind of share about the vaccine. More particularly, what have you all heard from the BIPOC community, specifically African Heritage, and then also leaving it open to kind of even discuss next steps and also preparation as we talk about post-pandemic and what we should expect. So I'm going to turn it over to the two of you and welcome again to the council. Oh, Commissioner Malcolm, you're on mute.
It seems to mute you if you're not talking. That's probably a feature. That's good. Good evening. It's very nice to be with you again. Thanks for inviting us back. And pleased to be here with Dr. Chomilo. So I don't know if you'd like us to go in a particular order or more interactively.
I think interactive would be awesome.
Okay. Dr. I don't know if do you have any opening comments that you want to make, and I'll kind of chime in after.
No, I had more plans to kind of follow your lead, and
Okay.
particularly, from the Medicaid, I just want to clarify, Chair Narita, medical director, not the Medicaid director of the whole shebang, the medical director. And so I think kind of you can set the public health picture, and then I can kind of talk about maybe some of the things specifically around Medicaid and other efforts around the community.
Great, good. We'll do that. And I think Shakira, are you able to project some slides for me?
Yes, I'm all set.
That's great, thanks. And I also want to acknowledge and thank my colleague Elizabeth Ebo, who's here to join the conversation. I'll just make a few comments, share a few slides with you, and these slides are available to you so we don't have to go through them one by one. But we were also just talking about, kind of an overall, in addition to the vaccine, kind of where are we with the pandemic? And I think you probably have heard many of us saying, while we are just really grateful that we're in a much, much better spot than we were in November, when we were seriously in danger of exceeding our health system's capacity to treat everyone that needed treatment, not just with COVID, but squeezing out other critically needed medical services. If all the COVID cases were taking up all the healthcare capacity, we're in much better shape down to case levels that we saw in the early summer and hospital levels that we haven't seen since earlier in the spring. So that's a good thing, but we still do have a lot of virus circulating in the community. We're still at case rates per 100,000 people that are, we consider to be sort of a high risk situation. We're at about 13 cases per 100,000 population per day, and that is a high level of viral activity. So we're still needing to keep up our vigilance. We're very concerned about the new strains, the variant strains of the SARS-CoV-2 virus that are circulating, that we know from other countries are more easily transmissible. And there's growing evidence that they may also be lead to more severe illness. So very concerned about that. And we are doing a lot of surveillance testing for trying to keep track of how much of the variants we have here in Minnesota. We are watching a couple of hot spots that clearly are B117 related. So much as we are all feeling better and the vaccine's arrival is a really good thing, there's still a lot of need for caution. And I just want to thank this council. I know you have been really, really focused on the pandemic's disproportionate impact on people of African and African American descent, and we just know that the outcomes are indeed much more dangerous for the BIPOC communities in generally when it comes to severity of disease, hospitalizations, and unfortunately mortality, especially when we look at that on an age-adjusted basis, which shows the inequities to be even more stark. And I'll be the first one to say that I think the criticisms of the earliest phases of the vaccine rollout have not shown to be equitable in terms of members of the BIPOC community and the Black and African American communities in particular not getting access to the vaccine at the same rates as the white population, despite their worse outcomes. So we have to do better. But we are listening to the community, appreciate the feedback and the very specific suggestions for what to do differently and better. And I feel that we are evolving the strategies and making better progress as a result, but really need your continued partnership, your help in thinking about this and in learning as we go. And I just do want to also say that our staff, Elizabeth and colleagues, in our health equity work and in our vaccine equity work have been working really hard to build partnerships with community organizations and to be really pressing that we do embed equity in all aspects of our response, whether that has to do with what the strategies are, what the outreach efforts are, how we make prioritization and allocation decisions, and how we think about equity in our planning efforts. And most importantly, we can have great plans, but if we're not measuring the effectiveness of those plans, if we're not really paying attention to how they're being implemented, then the plan isn't the end of the world, end all and be all. It's how we implement it and how we learn that's important. We are making good progress. We're now just about at 1.7 million total doses delivered. That's about 20% of our total population that's had at least one dose of the vaccine, and about half of that group, a little over half of that group, have now had both doses of the 2-dose vaccines. The arrival of Johnson & Johnson as a 1-dose vaccine is really welcome development. That's going to help us get more people vaccinated and fully protected more quickly. But there's just a lot more work to do. So a couple of the things that I just kind of wanted to talk about tonight is where are we with eligibility, with who's eligible, what's up next, what are some of the equity strategies that we are working on, and how can you as community leaders really help us as you are by representing the needs of the communities, but also helping us be smarter about how we communicate and how we reach people. So I'm just going to go through a few slides here, and I appreciate the help very much. We can just go to the next one. These are just some resources, and these slides are available to you, so please do check them out at your leisure. There's some good resources linked here that just kind of specific ways for being able to keep track of what the status is, what our guidance is for providers, which is very important, and giving them direction on how they are to be allocating and prioritizing. And as well, I particularly wanted to point out the vaccine dashboard, where we've just last week begun to post some data on race and ethnicity, which we're quite glad to have been able to make a forward step on adding that data in. So there's some resources for you to look at. And this next slide talks about who can get vaccinated now. This, you might have seen this, was the governor used this last week when he kind of announced the glide path for the stages through which everybody will be able to be vaccinated. Hopefully people can see themselves, kind of in the picture and when they might expect to be vaccinated. That the yellow boxes there are who has been vaccinated up until this point, or who's been eligible. And we know we started with healthcare workers and with residents of long-term care facilities in particular, and then expanded into the over 65 population, educators and workers in early child care. And are making, really pretty good progress getting through those populations. And then last week, the governor sort of laid out those next phases of who was coming next: people with underlying medical conditions and with high risk and rare conditions and certain disabilities that can create vulnerability for more severe COVID outcomes. And then workers in particular, kind of frontline, public-facing, or certain workforce conditions or workplace conditions like food processing plants, where we saw some of those large outbreaks last spring. So that graphic just kind of lays out the general next phases. But just this morning, we are making such good progress that we were able to accelerate the next steps, and we'll be getting into that next tier of people with particularly high-risk medical conditions and food processing workers starting tomorrow. So a couple of weeks, 3 weeks ahead of where we thought we would be. And we forecast being able to get into those larger groups of more people with underlying conditions and a larger group of essential workforce sectors not too long after that. Really, we're kind of doing those things in parallel with a priority on that first tier of people with really high-risk conditions and food processing workers, but we're kind of moving in parallel. And the governor used this image of a freeway with lanes on it, and the lanes on the freeway for those with underlying conditions and those at higher ages, those they continue to be eligible and they will continue to be prioritized. But as they continue to move through, we're going to add more populations in and do so more quickly. And the next slide just reminds about how people can, where people can get vaccinated. I mean, we one of our advantages here in Minnesota is we've got a really pretty well developed system of multiple vaccinators that do a lot of vaccinating for other conditions. So we have our state-sponsored community vaccination sites. We've got our local public health agencies all over the state. We've got, of course, our healthcare providers, our federally qualified health centers, and other community health centers that serve similar roles to the federally qualified centers, community pharmacies, tribal governments. And what we are particularly excited about is working in partnership with community-based organizations, with local public health and healthcare providers to stand up community-based vaccination sites that are in some of the sites where communities gather and will find it easier to access vaccines, whether those are community centers or houses of worship. As well, we are going to be developing some mobile vaccination programming to really get the vaccine deeper into communities. And that was always the strategy, to kind of use all those different distribution channels so that people can closest to them in most convenient ways. The next slide just talks about how can people kind of keep track of where is the vaccine. I hope you've been able to maybe check this resource out for yourselves and your communities. The Minnesota Vaccine Connector is a way for people to just to sign up, and then they're sort of pre-registered, if you will, or on the list. It's totally voluntary, of course, but if people sign up on the connector, then we have the ability to proactively communicate with them when their eligibility category is up. So if I'm on there and I am a 65+ person, then the connector will tell me you're eligible and the vaccination opportunities for you are X, Y, and Z. And that's just or if people have underlying conditions, this is just a way for them to to get information sent to them about their eligibility and potential sites. And we use these lists to help connect people with appointments where there are open appointments. Like if it's a state vaccination site or a clinic or a pharmacy, we'll say, here's a list of 200 people in your area that have signed up to be vaccinated. Reach out to them and offer them appointments. So it really is a way to help people not just theoretically, but actually get connected to vaccination. But we certainly know that there are some accessibility challenges with the connector, and it is not the only. We're trying to work on that, make improvements to that, but we know that's not the only way for people to know what's going on. And then there's the Vaccine Locator Map, which people can just kind of plug in their location and see where who are vaccinators in their area, who's got vaccine. And within the last couple of weeks, the federal government has started making some direct allocations. In addition to what the state gets, the federal government is directly allocating doses to a number of national pharmacy partners, some of the bigger chains like Walmart and Thrifty White and Hy-Vee. here in our state. So those are just some good, again, resources for folks to kind of be able to track where is the vaccine in Minnesota. We have been working really since the beginning on plans to know how are we going to make sure that the communities that are the most adversely affected by COVID have access to the vaccine. And we refer to it as our Focused Communities Action Plan. And a number of our staff have worked really hard in partnership with community organization to create specific strategies for reaching focused communities. That they are the source of some of the strategies that we announced last week. We have invested some pretty significant resources, $20 million so far, into our partnerships with community-based organizations and diverse media groups so that they can serve as COVID community connectors, just helping us to make sure that we're getting vaccine to the right places, and then helping to recruit community to take advantage of the vaccine when it is available. So I just want to point out a little bit of this new data. I don't want to take all the time here. Anxious to hear from Dr. Chomilo, so I'll just go really quickly. But these next few slides are showing you what data is now on the vaccine dashboard. So you can look at that at your leisure. It's a pretty good device, actually. If you could just advance to the next one, if you would, please. It's an interactive site, and you can select different ways of looking at the data. But this, for instance, shows what percentage of each of the racial and ethnic groups, what percent of that population has been vaccinated. So here we can see, as of a couple days ago, and this is the report, what was in the, whoops, that's back to the beginning there. Thank you. So each day, the data reflects what was reported 2 days prior. So this is what was on the website yesterday, but it's data from 2 days ago. So it's been, so the data are improved since then, but this shows us that just under 9%, or excuse me, just under 10% of African immigrant and African Americans who are vaccine eligible by age have received at least one dose. Next slide, though, also, and this just shows how each population, what share of the population has been vaccinated, or what share of the vaccinated population do these groups represent in comparison to what share of the total population they are. So this is the slide that really shows, at least by this basic demographic of race and ethnicity, that, for instance, African immigrant and African Americans represent 3.5% of all the people vaccinated so far, but are 6% of the total population. So they're under vaccinated as a share of the population. And you can see there that the white population, even though it's just under 79% of the total state's population, has gotten over 90% of the vaccinations. So over vaccinated in that sense. Not totally surprising, just given who those first eligibility groups were, knowing that those would be disproportionately white populations. But this will be increasingly important data as we expand into broader groups of the population to make sure that we're closing those gaps. And the next couple slides just are additional cuts of the data. This one looks at the over 65 population. The gap is not quite as great there in terms of percentage of over 65 versus their share of the total population. Here we look at how those large state sites, those state-sponsored vaccination sites, not doing such a great job in serving a diverse population, and fully 31% almost of the folks going to those state sites have not shared their data with us. So there's a big group of unknown or missing there. But we can see that, again, just a relatively small numbers of diverse populations have been served by those sites compared to their share of the population. But federally qualified health centers, on the other hand, are doing a much better job of reaching those populations. And that partnership and directly allocating doses to them, and also giving those clinics flexibility as to who they are vaccinating, has been and will continue to be an important part of the strategy. So again, I'm rushing really through this, but you can look at these data more closely when you have time. So I think the next couple slides then kind of get into the strategies that we're doing. I mentioned, continuing to directly allocate to federally qualified health centers, but adding some additional clinics in who function in much the same way. I want to point out this last one, that we've encouraged federally qualified health centers to be doing some piloting of initiatives to vaccinate patients at a younger age with underlying health conditions, as well as vaccinating family members if they bring in someone in one of those eligibility categories, as a way of serving more people and an incentive to help get them in. The next slide talks about a similar strategy with respect to community pharmacies. So they're the big chain pharmacies, but then they're also a network of community pharmacies that are located in high social vulnerability index areas. And so making sure that we are allocating doses directly to those pharmacies that are located in those areas, and giving them similar flexibility to vaccinate a broader populations by virtue of their greater risk at younger ages with underlying conditions. And then the next one, I think, speaks to this idea of working with our COVID community coordinators to set up vaccination clinics that are more community-based, to help find those sites, help stand up those sites, and then build a pipeline of people who want to come in and get vaccinated at those sites. And that is a promising strategy. Working with as I said, churches, for example, or community centers, or housing housing units, where we know there are lots of people that would be interested in coming to get vaccinated in those specific community sites. So look for more of that. And then I think that the next one is the mobile units, I believe. That we're excited about that idea of bringing vaccine really literally into the communities, working with our local public health. Some of the health systems are doing similar things, and this is just a good way to specifically address some of the access barriers that we know communities face around time, technology, transportation, other constraints. We need to bring the vaccine to the communities, rather than having the communities always needing to seek out the vaccine. And then the next slide, I think is also speaks to some of what the federal government is supporting with those doses to specific pharmacies. We're piloting, kind of trying something with the Brooklyn Center Walmart for the next few weeks, with having the COVID community coordinators proactively working with members of the BIPOC community to literally get them scheduled for appointments. So kind of that customer service almost focus to help people get registered. And if that works well, we'll find ways to expand that to other pharmacies. And I think hopefully I'm almost done, because I'm eager to turn it over to Dr. Chomilo here. Is there another one? Or are we at the end here? Oh, I did want to point this out. In the most recent, the guidance that we put out for providers for these next categories, we wanted to lift up some language that specifically calls out the need for providers to consider multiple risk factors when they are making kind of those sub-prioritization decisions. When they have a limited amount of vaccine and they've got an eligible patient population, who do they go to first? And we're encouraging them to use this guidance to consider all these multiple risk factors in prioritizing their patient population, and trying to call that out more explicitly. And I do believe that was the last slide. And sorry that was so fast, but want to turn it over to Dr. Chomilo and then leave some time for your feedback and questions. And I know this isn't the only opportunity to get your feedback, but if you have some immediate reactions, I'd be pleased to hear them. But Dr. Chomilo, over to you.
Thanks, Commissioner Malcolm. Are you able to move the presenter to me so I could present from my... I don't know if Shakira is able to. Perfect. So actually, it was a very nice transition there at the end with what Commissioner Malcolm provided as far as kind of the overview of where we're at as far as vaccine allocation and the efforts to continue to get it out into the community. Where we come from the Medicaid side is we know that our enrollees have needs that are distinct from other enrollees, and we serve communities that are distinct from even the general Minnesota population. And so we've put out some guidance to our partners on how to really operationalize equity in the ongoing COVID-19 vaccine rollout. So I'll walk you through that here relatively quickly so we can get to time for any questions. But really nationally, the data that we saw at the beginning of February was already telling a familiar tale. So the CDC's Morbidity and Mortality Weekly Report in February 1st showed that amongst phase 1A, Black Americans who are eligible for the vaccine, there was a lower number who actually received the vaccine than those who were eligible. And so we were already starting to see a gap form even through the first phase of vaccination. And when we look at national data for Medicaid patients, particularly if we look at the 65 plus population, we've known for months that those who are served by both Medicare, which is what everyone is eligible for when you're 65, and then there's individuals who are on Medicaid and Medicare, and so who need additional assistance beyond what Medicare provides because of their low income. Those individuals had higher rates of COVID-19 hospitalizations, higher rates of deaths, and we had a similar disproportionate burden amongst Black, Indigenous, and other populations of color. And we saw similar trends in Minnesota when we looked at our data of those who are 65 and plus, and so our BIPOC elders here in Minnesota had higher rates of some of the comorbid illnesses due to things like structural racism that produce things like higher rates of diabetes and hypertension and heart disease that increased one's complications for COVID-19. And then additionally, we also know for all of our enrollees, looking across the medical assistance or Medicaid program in Minnesota, that we see the highest rates of many of those comorbid illnesses, again, in our Black and American Indian communities here in Minnesota. And so in addition to those risk factors, we know that our enrollees historically face additional barriers to care, even before just thinking about getting a COVID-19 shot, just getting actual regular care. Many enrollees report barriers to transportation, access through things like access to interpreters, barriers to getting time off of work, or having issues with family or childcare needs that can't get met so they can get to the care they need. Or even discrimination and just feeling like you're not getting the care you need because you're facing discrimination at the clinic or hospital. And then in addition to this, as I kind of alluded to before, we know that Medicaid in Minnesota serves populations differently. And so well, if you look at our straight enrollment, there's a slight overrepresentation, if you will, of kind of Black and Indigenous communities. When you actually look at the community as a whole, how do Black Minnesotans in Minnesota generally get their healthcare, access to healthcare? This data from 2018 shows that for those who are under the age of 64, so the next phases that we're moving into, 44% of Black Minnesotans get access to healthcare through Medicaid or Minnesota Care coverage. And so, changes in how our enrollees are served disproportionately impact our community. And so it was, given what we know about the communities we serve, the structural and societal barriers that our enrollees face addressing care and the disparities we're already seeing in COVID-19 vaccine rollout, we felt it's really critical that the providers, counties, tribal nations, and contracted organizations that we work with are taking steps to not just mitigate, further inequities in access, but actually use this opportunity and increasing access to continue to build a more just and community-driven approach to health. And so this guidance is going to provides three kind of different buckets and areas for our partners to consider. One is, how do we use data to guide strategy while improving collection of data around vaccination? And so thinking about things like using the CDC's Social Vulnerability Index, which the commissioner referenced, to identify areas of high need where vaccine distribution and outreach efforts should be targeted, creating a vaccine equity dashboard. And so not just looking at the data, but then actually using it to kind of help drive measures of change, and then look at that and pair that with how are our BIPOC communities doing. Can we look at the percent of total individuals vaccinated, or percent of total shots given per community, similar to what Commissioner was reviewing in the data? And then using that to kind of target, again, ongoing outreach and then community partnerships. And this is just an example of how that social vulnerability index data can be used. This is a map with using that SVI index from 2018. And so those darker blue areas are areas of higher social vulnerability. And so you can see that it's kind of spread out across the state, and you can zoom in on the Twin Cities there as well. But really the social vulnerability index, it takes into consideration of roughly 15 different indicators. So it includes not just race, but things like income level, high school diploma or not, if there's anyone in the house that's age 65 or older or under 17, anyone in the house that has a disability, is there access to a car, is there multiple in families living in the same unit, or so issues of crowding. So a lot of different factors to kind of get an idea of an area's social vulnerability, and therefore then be able to target our responses more appropriately to those who are at higher risk. And then I just wanted to point out the data. So the commissioner did a good job walking through this data, and you can see, on the dashboard, you have ability to kind of look at it in different forms. So she's used a lot of the charts on the right, and on the left, you can kind of see how by different age groups our communities are doing. And so this is looking at the left at 65 plus. This is numbers reported as of the end of last week, or a couple weeks ago, I should say. And you can see the difference there amongst Black and African American Minnesotans being around 38% and 45% for our white Minnesotans. And I think the other thing that is really important to look is the trends, right? And so what are the trends telling us? And so I think that should give us an idea that if the trends are continuing to show gaps, we don't only need more of what we're doing, but we also need to find ways to do things differently. And so the data, I think, does a good job displaying that there. And then again, you can see the similar data for just all those eligible, so those 15 plus, and the trends that we see there as well. And so really encourage the council to take a look at this website. It's really well put together. And I think there's a lot of information that you can use to ask further questions and follow up. The second bucket is integrating COVID-19 vaccine outreach and efforts into existing community-identified service needs. And so, COVID-19 in itself and the pandemic has shown us over and over that we have opportunities to really address many of the structural inequities that produce the racial disparities we see in health. And so vaccination is just another chance to build upon those relationships that have been building with communities most impacted by those twin pandemics of COVID-19 and structural racism. And so not only kind of use the kind of existing pathways from COVID-19, but there's been a lot of investment in just trying to address, social drivers of health or social determinants of health. And so how do we use those community relationships that are built to address social determinants of health to address COVID-19 vaccination? And so looking at multiple ways to communicate to community, not only just traditional, but thinking of are there ways through social media, even through getting ads on streaming services, or other ways to get and meet communities where they're at, depending on their age, their use of technology. How do we find ways to co-locate COVID-19 vaccination with places where people are already getting to get the resources they need to live and thrive, right? So if they're already going places weekly to get food, if they're going places to get job training, if they're going places to get housing assistance, how can we find ways to, and have our partners find ways to co-locate COVID-19 vaccination so you don't have to kind of be bouncing all around town to get your needs met? And then finding transportation being key to that. And so within the Medicaid program, there's actual benefits to get to your just regular appointments. So you don't have to take an ambulance. You just call and figure out a ride. And so that's called non-emergency medical transport. And so having our partners really make sure that folks on our programs know that they have that benefit available to them. They've even extended it for those in kind of greater Minnesota areas so that you can get further distances away than you usually could to get access to COVID-19 vaccination. And then I think the healthcare setting is a really good setting to help engage our patients and enrollees, our community members around the vaccine connector. So I've heard a lot of concerns about how easy it is to sign up for the vaccine connector. And I think when you're in the clinic setting, you have oftentimes a translator or interpreter if needed. You have your nurse or your provider that can kind of talk to you about the benefit of signing up for it, walking through it. You might have another caregiver from the household there with you too, who knows that, all right, you've been signed up for it. So I can touch base with you and ask you later, mom or dad or auntie or uncle, did you hear yet from the vaccine connector? Is it your turn yet to go get your shot? This is just an example of one of the kind of local efforts that's going around. So Maple Grove Transit is offering free rides to and from COVID-19 vaccinations. And so just an example for our partners to really identify what is already going on and how you can connect our enrollees and members to those resources. And then the last piece is investing in infrastructure that really serves our enrollees, not only during COVID-19, but beyond. And again, just focusing on how the barriers have been, the many barriers in our society to accessing care and have been laid bare by COVID-19. And so how can we use this moment to kind of not just meet the needs of a COVID-19 pandemic, but the needs of our communities beyond. And so, one such way is looking at how we make appointments. And so to the kind of building off of what the commissioner ended there with the guidance talks about how within these categories, until we have enough shots for everyone who wants them to get one that day, we still have to kind of sub-prioritize. And so our enrollees should be amongst those sub-prioritized. It makes a lot of sense to maybe hold appointments for them before opening up to the general public, knowing the different barriers and access they have. Creating mobile vaccination units, which is what the commissioner talked about from the state level, but there's ways that some of our partners can do that as well. There's also this community paramedic benefit where ambulances can actually go to individuals who are homebound, and so we're looking into that as well. And then continuing to kind of build upon the relationships and really continue encouraging our partners to build a network of BIPOC community leaders to not only address COVID-19, but continue to address the needs of our community, and using that great network that's been built up by the COVID-19 community collaborators as a great starting point if our partners don't already have connections of their own. And so again, just wanted to call attention to the guidance that Commissioner Malcolm and her team put out last week about sub-prioritization of high-risk people, even as we go through these next steps, and how it explicitly calls out our enrollees on Medicaid, as well as our communities that have been disproportionately and continue to be disproportionately impacted by COVID-19. And this is an example of a program in Indiana that uses that ambulance benefit to help homebound individuals. And so we're going to continue exploring that as a possibility. And then I just want, the commissioner already kind of touched about the COVID community coordinators, but noting that they do much more than just even vaccine help. They can do a lot of different social services and supports help during COVID-19. And so making sure our partners are aware of them and reach out to them. And then just wanted to end that this guidance is adapted from some really great work from Johns Hopkins. And so I wanted to give them the shout out. And then this is the kind of quote I've been leaving people with and kind of really challenging them from Martin Luther King Jr. is that, you know, we must come to see that human progress never rolls on the wheels of inevitability. It comes through tireless efforts and persistent work of dedicated individuals. And without this work, time itself becomes an ally of the forces of social stagnation. So we must help time and realize that the time is always ripe to do what is right. So at this point, open up to questions, and thank you guys for your time.
No, thank you. So I have two off the bat, and I see that there's a lot of chat, and I don't know I haven't looked at the chat questions yet, but it could be similar to what I'm about to ask you all. What is being done, because we know that there's a lot of hesitation or resistance within the Bible community, specifically within the African immigrant and African American communities, about getting vaccinated. So what have you all been, educating us on that? And then, what we look forward to is how are you preparing, educating folks around that?
It's such a great point. And clearly, I think it goes right to what Dr. Chomilo was saying about you need to use trusted community voices to deliver these messages. And that's part of the role of the COVID community coordinators, to be that, but also to help us find those people. And the diverse media, working with, the Black pastors, for example, just finding those leaders in community. And certainly, looking to our health professionals who come from these communities, physicians, nurses, therapists, others, pharmacists, who can directly address the very legitimate questions and concerns, historical and otherwise, that the community has. And I just have a feeling that people would feel differently hearing it from Dr. Chomilo than from me. So I think that's just really important, to find those community voices. I mean, the data, I can tell you that for all three vaccines, the clinical trials did a good job of including all populations. And the data are very clear that the effectiveness holds across different groups. So, and that was important, that the trials be able to demonstrate that.
Thank you for that.
Yeah, and I just echo that, and that there've been a lot of opportunities brought to my attention from the Department of Health through some of those partnerships. And so speaking through channels like KMOJ, Minnesota Spokesman Recorder, doing events at like Shiloh Temple. And then I'm connected with Minnesota Association of African American Physicians. And so there's a lot of other doctors, Dr. McKinney, Dr. Crutchfield, Dr. Rosario, Dr. Morgan, Dr. Setterstrom, who are out there sharing our experiences. And I think it's important to kind of share it honestly, and, why we decided to take the shots for ourselves, why we, what are the things we weighed, and kind of facilitate conversations that way. And so I think that's ongoing. I think it's a little bit of a hard calculus in all of this, because you want to get people like the answers and information they need, and then when they're ready to get their shot, to have a shot ready for them. And I think what we struggled with is we still don't have access for all the folks that we want. I think, hesitancy really isn't the main issue and why we see those gaps in numbers right now. It's access. I think come summer, there'll be more hesitancy, that if we still see gaps is the thing that's kind of lagging. But right now it's kind of getting access to folks. And so that's where a lot of the efforts, in addition to the education, are going.
And I'm now going to jump to what questions were in the chat. And it's funny because Quentin, that's probably the question I just asked. So unless you wanted a different response, because I'm looking at your question and it was pretty much the same thing I asked, and I hadn't even looked at your question.
Yes, it's very similar. I'm thinking, and I just want to thank you all for like the access that has been given to people so far. But there are individuals and families that I'm working with who actually, you know, they actually have the access right now and are literally like educators, for example, who are literally choosing not to take the vaccination. And so I hear what you're saying. I'm receiving it. And I was just wondering if there was anything that we could look forward to, like for those individuals. And that's it. But yeah, I mean, it kind of answered the question.
Okay.
And I would just add to that, thank you, Quentin, that a lot of these things have been recorded. And so what might make sense is we can kind of put together, and I know the Minnesota Association of African American Physicians has on our website is kind of compiling all the different kind of panel conversations, interviews, things like that we've been doing over the last couple months, and we could maybe send that to the council to kind of distribute out to folks so they can watch it on their own and kind of and see if their questions or concerns get answered there. But in addition to that, I think there's going to be ongoing conversations and opportunities to have folks get their questions answered.
No, thank you. That'd be helpful because we do produce a newsletter, and if there are links, we can embed those right in. And I can't think of what our bandwidth is at this point, but I know it goes to quite a few constituents, and so I think that would be helpful because we know that there's so much hesitancy around getting it. There's even hesitancy within my own family. So my mother and I have gotten it, but my kids are like, yeah, y'all go ahead. So, that's just a prime example from there. So I'm going to jump around on these questions here. Another council member has asked, and it's a lengthy question, but I think it's advantageous to ask it. How is messaging different or more tailored to be more sensitive to people of African heritage and also people who may not speak English or English is not their first language? And it's in the chat, so I'm gonna just read the whole thing. If y'all need to go back to the chat to kind of, answer it. Also, what are the different ways that people are being communicated with? Because we know that access to the internet isn't an option for everyone, and mainstream communication isn't how everyone receives information. It's a lengthy question.
Yeah, no, and I think some of what we just talked about applies here too. I think, as Dr. Chomilo said, I think that community-based media is really important, and just those personal connections, and having resources to help people, whether it's help people navigate the technology or not have to use the technology. In the connector, there is an option, for a phone. To do it by phone and have somebody, help you with it. There are translators. The connector is being translated into languages other than English, but right now there are translators available to help somebody through it. And I really have to apologize. I have another meeting starting a minute ago, so I need to run, but I will really appreciate the time to chat with you. And I'm sure Dr. Chomilo has at least as much, if not more, to say than I do. So,
no, thank you, Commissioner Malcolm. We so appreciate you taking the time out.
Thank you. Nice to see you all again.
You too.
Good to see you, Commissioner. Thank you.
Good night.
So, yeah, I would just add to that as far as that's key is how you tailor the message. Picking the messenger is what the state as an agencies have done so far, is trying to use the community connectors to kind of identify the different messengers, and it's different even within a community, right? Just like you were talking about with your family, there's a generational gap there, and I see that in my practice when I'm talking to parents of young children versus the teenagers versus parents of older children, and so I think it's really important to have and think and approach the different parts of the community, and I've even been in some conversations kind of nationally looking at this issue too. Are there ways to get other cultural leaders, whether they be professional athletes or entertainers, to kind of have conversations about the vaccine and how they're making their decisions, to kind of help people in that way too. And so that's not something that the state is currently engaged into my knowledge, but that's something that is kind of going on, and so I'd kind of keep your eyes peeled for those type of efforts too.
So I want to ask two more questions, and then I know, I'm sure you probably have to go, you have family, but one that I definitely want to ask, and then I'm going to ask Jude to ask one of his questions, but Councilmember Crawford raised a very good point. One group that's often left out are people who are incarcerated. And so that's, unfortunately, we know this, it impacts people of color and also poverty more than any other group. So how can we advocate for that group? Or the other question is, what's being done for that population to ensure that they are also, eligible to get the vaccine?
Yeah, so there was a lot of conversation about that because people who are incarcerated are basically congregate settings, much like those who are in long-term care, and they're in a place that they can't leave. They might have gone afoul of the law, but at no point did the judge say you're sentenced to get COVID-19, right? And so there's ethical reasons that they should be getting the vaccine as well. And so the good news is that with this announcement today, that they are part of the workers and those in prisons are part now of the priority access. And so, we'll just have to continue to, push our public health agencies to get them those shots and arrange for that and make sure it's done, in an ethical way, because these are still all under emergency use. So people have to have the right consent and information presented to them to make the decision. But yeah, that going forward, hopefully is not an issue because they're a part of the priority groups going forward. And I know that some jails were already starting to kind of offer, the tricky part with jails in particular is that, before we got the Johnson & Johnson shot, which was just a one shot, it was a 2-shot, which means you had to have like at least a 3 to 4 week interval between the shots, which there's a lot of turnover in jails. So there's some folks that are, in jail for much longer than that. But the majority of folks are, in jail for, a couple of days and then they're out, and then you're going to tell them to come back to jail to get a second shot. And are they really going to want to do that? And so there was kind of some logistical issues just based off of the shots. But now that we have the Johnson & Johnson, and now that they're part of the priority groups, I think we'll hopefully see, more concerted efforts. And I think just continuing to talk to, local leaders about where we're at with that would be a good way to keep that all on our radar. But that was definitely part of the conversation for some time. And I'm glad to see that's now part of the priority groups going forward.
No, thank you for that. So Jude, you want to ask one of your questions and then we're going to wrap up.
Okay, thank you. Nice to meet you again, Nathan. So one quick question I want to ask, or maybe just some suggestion, is to interpret some of the messages in West African Pidgin English. In West Africa, more than half speak Pidgin English, and some of us, migrate here, and we know that we do that. So MDH doesn't know much about that, and that takes me to the second maybe suggestion. I would like to connect with you later after the meeting. But one thing again is that with this COVID and vaccination, there are a lot of resources being put in place, but generally our people, Black people in the state, we don't have much access or connection to be part of solutions. Whenever there's community engagements and some other ways, they come to us, they provide a solution, but actually we have capable hands that can actually be part of the process. But in most cases, because of historic barriers, they don't put themselves out there like in IT and some other places, and they provide great solutions to problems, and they can actually participate in being part of the solution to this vaccination and other things we have. I brought that up in a community resiliency group where we meet on vaccination. I also talk to the governor's office, and I just keep raising the issue whenever I have the opportunity, because we can actually be part of the solution, not just take care of other solutions we have.
Yeah, thank you, Jude. And so, and I think you recall that my family heritage is Cameroonian, so I'm well aware of the use of pidgin, and then I practice in Brooklyn Center, where many of my families speak a form of pidgin or their dialect, and so that is definitely a gap. I'll definitely pass that on to the commissioner as well. And what I've seen, just kind of personally, I've been talking to systems about, is we need to find ways onto kind of some of these social media services like WhatsApp or other services, and even finding ways to create videos, or not just written information, but how do we create videos. And so if you have ideas about folks that can help kind of translate or curate messages, if given the kind of content, that would be a great place to start going forward. And then I agree as far as getting more community involvement early on. I think some of the issues been that until this week, really the priority has been 65 plus, and that community is 94% white, and so there wasn't. We could have engaged the community a lot, but we wouldn't have had shots to give them because of how the priority was. And so I think I'm hopeful going forward that these more micro-targeted efforts are going to start bearing fruit now that we have a little more flexibility to operationalize equity.
Thank you.
Well, Dr. Chomilo, thank you again for coming, you and Commissioner Malcolm. Again, I love these conversations because we know this is just not a one and done. Let's come and do data dump and go, so I like that we're having this dialogue. And then side note, thank you again for agreeing to present in April. I kind of threw your name out there to my college. So
sure.
But yeah, I mean, if there are any follow-up questions, we're happy to send out Dr. Chomilo's information along with Commissioner Malcolm, and council members. Please feel free to email them directly or even get it to Shakira, and then we can get some other responses. But thank you so much for spending your evening, because I know you didn't have to, and I'm sure you already had a long day like we all did. It's much appreciated. So thank you.
Very welcome. Thank you guys all that you're doing for our community, and happy to come again whenever called. So
thank
you.
You guys take care.
You too.
Thank you, sir.
All right, so we are going to move forward with, and we're a little behind, but that's okay, because I didn't want to stop the dialogue, because it's definitely needed. And I know that there's a lot of hesitation and resistance, in reference to, the vaccination. So I was glad that they could come and share that information with us. So I know we only have one community member. And has anybody did anybody sign up to say anything, Shakira? I don't think they did.
No, I haven't gotten anything.
Okay, so I'm going to keep going and presume there are no public comments, and we're going to go straight into the remainder of our time. So unfinished business, Day on the Hill recap. I said this at our executive council meeting, and I'll say it again. Hats off, team. That was a phenomenal Day on the Hill program. Even though it was virtual, I felt it went very smoothly. I got a lot of feedback where people couldn't jump on right away at 5 o'clock, but they went back and watched the recording, and they were like, man, that was awesome. You all did a great job. So I just want to publicly, say, hey, team, job well done, because I know it was probably one of those let's tear our hair out, but you all got it done. It flowed, and I don't know if there's any other feedback that the team wants to give, and even council members, if you were able to watch it, please chime in. I'm seeing some chat. They're saying the same thing. It was amazing. Great job, everyone. So any other added pieces, Theo, Amber, Linda, Shakira, that you all want to talk about with that?
Amber, do you want to provide some of the stats?
Sure. Good evening, everyone. I'm gonna keep my video off right now. I'm trying to change some settings because in my bedroom didn't really want to show that to the world. But it won't let me blur the background, so I'll figure that out at another time. But as far as some stats, and these were taken a week ago, so they may have increased slightly, but I don't think they've increased too much. But when I took the stats a week ago, there was about 90 views on YouTube. There were about 891 views on Facebook, 54 shares, 2,313 people reached, 189 engagements, 214 post clicks, 289 reactions, comments, shares total. So.
And that's really good. So just think that, you know, if we were face to face, we probably, I think we normally end up with, and Shakira, help me out, what did we end up with last year for people? Like, I don't know, Shakira stepped away.
I think it was about 300
okay
attendees.
I want to say, I know we had quite a few attendees, but
Yeah.
okay. So any other comments about the Day on the Hill? Thank you. Dr. Lawson said it was short, focused, and sweet. Thank you. If hearing none, let's move to council engagement. This is something that the executive team kind of talked about, and really it's how do we come up with ways that we can be a little bit more engaged out within the community, and not just necessarily, you know, come and meet monthly, hear about all the things that are going on, but really have intentional engagement. One of the things that that Lynn and I have been talking about with our one-on-ones is years ago, the council had an advisory committee. And so those topics are starting to resurface again. Do we want to, you know, come up with an advisory committee and then have these subcommittees that would be focused around core areas? One could be healthcare, one could be education, you know, one could be economic or workforce development. And so just wanted to throw that out there because we've been talking about this. And I think the more and more that we can engage our community and have us at the table, I think the better off it would be. And we said we'd probably, if we did these subgroups, we would want to have no more than 2 council members, because what happens if we have more than that, then we end up, you know, having a quorum. And so I just wanted to bring that up because it's been brought up before, but now we're talking more intentionality around what does that look like for us. And there's several groups right now that are doing that have kind of these subgroups, but we could use ours because we have a direct focus, which is not just to be a direct liaison to the governor, but also you know, to our legislators as well. And so I think that opens up a greater opportunity for us to do such a thing. So I just want to throw that out there. Any comments or questions in reference to that? All right. Well, we're going to keep it moving then. So moving into our standing items, Wayne is still, you know, soliciting volunteers for the bylaws. And I think what may end up happening, if we don't hear from anybody this week, the executive team may just take it on because there's a couple of changes that we want to make, and we don't want to parlay those changes that need to happen. So I just want to throw that out there. The commissioner's schedule, we have been talking about, at one point we talked about for April that we were going to do kind of this African immigrant, African American collaborative effort. And so one of the things that we talked about most recently is let's push it out to June. And so we will need to decide, do we want to have any special guests in April? One of the guests that we had talked about having is asking our Black legislators to come in April. So that's who we're kind of looking at, even though it's not a commissioner. But I think it would be good, especially while we're still in legislative session, to hear, you know, what bills are they authoring or what bills are they supporting? Where can we still dig in? Is there room for some of these bills where they need somebody to testify? And is that where we kind of step in and be able to do that? So hopefully we can have them present at the next council meeting in April before the session ends in May. And then we will decide for May, who do we want as far as the commissioner, and June will actually be kind of this panel discussion, if you will, between African immigrant and African American leaders. Questions about that? And I know I'm moving fast because I don't want us to go past 8 o'clock today. All right, well, we're gonna keep this pushing. Legislative seats. Michelle Weber, I see you on. Can I put you on the spot? Do you know where we're sitting? I know last they were in the midst of that, but my take is I'm sure with session going on and now the trial of Derek Chauvin, I'm sure that has kind of pushed quite a bit back, and the vaccinations.
Hi, everyone. Thanks. Yeah, I was pretty excited at your last council meeting because we were chatting privately in the chat, and I was reaching out to the appointments people, and they were like, yep, we're working on it, we're working on it, we're working on it. The Senate members, one of the things that does delay that process is that it requires the subcommittee on appointments to come together. And so it's not just, I know that the minority leader identified an individual that they were going to appoint, and then they're waiting for the subcommittee to come together when the appointments will be finalized. I can do some additional follow-up to see if we can get any movement on it. I know that the House majority also indicated that they were working on it, and there are a couple other councils and commissions that we're waiting for final appointments on, but I'll do some additional checking.
Okay, thank you for that.
You're welcome.
Oral history project, Shakira, can you give us an update on where we're at? I know you shared a great PowerPoint with us at the executive team meeting.
Yeah, so with the oral history project, we have our vendor. He's going through names of council members, past council members, past legislators, and past staff to interview. We're going to try to make it so that we have interviews with people across the past 40 years for the council. So having a couple from each decade speak. We're just going through right now, compiling that list and going through it and making sure that we're not limiting ourselves or selecting people who, for one, are deceased and limiting ourselves to just like one they asked for us. So we're trying to make it as inclusive as possible.
And so the date that we're looking at having this completed by is the end of the fiscal year, correct?
So the grant money can be used outside of the fiscal year because it's grant money.
Oh, good.
So we don't have to have him rush to try to do all 10 or 12 interviews before June, early June.
Okay, good. No, that's good to know. Any questions for Shakira in reference to the oral history project? All right, all right. I was going to say project plan, strategic plan. Linda, if you want to just give a quick update. I know the other day we had kind of a visioning session. Oh, you're on mute.
I had to go back. Okay, great. So first off, thank you for a very successful visioning session. I love the participation. It takes a village, right? So I think that there were some nuggets that came out of that. And then the team, the DeYoung Consulting team, did come up with a shared vision. And the shared vision reads as serving as a trusted community partner and legislative catalyst. The Council for Minnesotans of African Heritage ensures that Black voices influence policy and build an upward trajectory for the success and well-being of Black Minnesotans. So I will share this document that they sent us with you. The next steps would be to see if, one, we really like what they came up with, and then two, what is next? Do we go onto values? I know another thing that our chair and myself will be doing, we'll be looking at what's next on the strategic plan as it relates to doing strategy for the agency. So that's kind of where we left it. So the chair and I will be getting together probably over the next week or so at our next status and having that conversation as to how do we move forward from this. But I will make sure that you get this document and then we can have a further conversation about it.
Any questions for Linda on that? All right, Linda, the remainder is actually staffing report. So you all have the remainder of the meeting.
Oh, okay. Well, it'll be short for me. we spent a lot of time on like big issues. So just from an executive director's perspective, I've just been meeting with a lot of the legislators. My first tier is like the Black legislators, and then I have the Posse caucus leaders, and then I have like other leaders, legislative leaders. So Shakira has been helping me get that together. We did have a call with the United Black Legislative Caucus, and I hope I said that appropriately. So the Black legislators, in which our team and our chair joined us. We met with the legislators just to kind of do a meet and greet. 3/4 of our agency were new. 4 people from the caucus, they're new. So it's kind of like introduce ourselves and just have general conversation, which is what we're hoping that this meeting in April could do for you guys as well. You need to be connected to them because that's why we're here. So we want to make sure that they know who you are because you're doing some good work as well. I've been spending some time testifying on budgets and police reform and some other areas. Did a press conference for teachers of color, and I have to say that our new legislative director has been phenomenal in helping to set some things up, as well as, of course, Amber. That goes without saying with her, but Theo has been very instrumental in driving some of these initiatives, especially as it relates to police reform, and he'll chat with you about that later. I'm just serving on various task forces, transportation, childcare, violent crime, and what have you. Had to do a budget presentation, testifying at a budget hearing. And then next to last piece would be like the budget for the unobligated funds. So primarily what we're looking at is kind of upgrading the office. There's some lime green chairs in the office. For those of you who have been on the council for a while, you may have seen those, but yeah, they're horrendous. Let me just say, so we want to try to get rid of those. It's time to upgrade phones, headshots. We want everybody on the board to have their headshot. And that's something that we'll be coming back to you with as we get a contract for that. And so we'll come back to you fairly quickly on that. And then just some office decor. Now is the time because we do have the budget to make sure that the offices are painted and everything is in order when we move back in. We want people to come into our office space, maybe see some Black artwork and feel proud about what we're doing as well. Let's see. We are looking at maybe having a branding campaign for the actual agency and the work. One of the things that we discussed was that there are things that are happening that the community doesn't know about. And the other piece is the community still thinks of us as the Council for Black Minnesotans, some in the community. And unfortunately, the agency at that time did not have the best reputation. And so what we're trying to want to do is say, okay, here's where we're going. This is what we're doing. We need you to help us. Let's get together, team. And we want to talk about all of the work that's happening and try to get people excited about what we're doing. And I know that there's been some headway over the last few years, which is great. And so we need to carry that momentum on. And we were thinking a branding campaign might be a good way to do that. And then I want to look at also, we have access to some polling data, and Amber, correct me if I'm saying it incorrectly, but some data that, research data that Amber and Justin and team worked on prior to my arrival that I think might be worth looking at, seeing if we can package it up and send it out. Because again, that is also work. So we want to build this organization up and let people know what we're doing and how to get them engaged. Because people get excited about working with people when they think that things are happening, things are moving. And so that's part of what we want to do. So the last piece is, unfortunately, I have to report that our communications consultant had to step down. He's got some other things, family things, and some other issues that are going on. And so he just said he just, at this point in time, could not handle working with the council any longer. So I'm very sad about that, because he also worked with Amber on the Day of the Hill video, and he's the one that has done a lot of our statements and letters. And so he's done a phenomenal job. So thank you to Reggie. If you're listening to this, Reggie, we love you, don't go. But no, he's done a phenomenal job. And so needless to say, we do have to replace him. And unfortunately, we're right in the middle and at the start of the trial where we need to be able to communicate to our people. We've got to be able to put statements out there. We've got to be able to report. So we have that. There's, and Amber and Theo will talk about some other things that are going on that are going to require that we have a communications expert. So one of the things is that this just kind of happened recently. We don't meet until April. So I just want to see if I can get a pulse on whether you guys feel comfortable in terms of us looking at somebody and trying to move on something quickly. And then we'll make sure that we do whatever we need to do within the confines of our bylaws. But I just want to make sure that you guys are okay with that. And I just saw in the chat, and I just saw two things in the chat. There was a question about whether he could take a leave of absence, and he is on contract, and at this time, so no. But that's not to say we couldn't bring him back at some point, but he might not even want to come back. You know, he didn't say, can I take a leave of absence either. He said, I've got to move out of this role because I have some other priorities. But we would look at that, look at him again. I thought he was good enough to do that. So, Madam Chair, is there anything that else I need to say about the communications consultant?
No, so let me just kind of give further context. What that does, especially with the trial that just began yesterday, it really does put us in a bind. And so I know that they're going to be meeting with some potential communication people this week. And so what that would mean, typically we would have a contract to look at and then approve a contract for them. What I had said to Linda is, because of the fact that they're going to be meeting with somebody tomorrow, if they end up deciding to go with that person, what we would need to do is we would probably have to call an emergency meeting, which we need at least a 3-day notice to do that. So we're kind of putting you on alert that we may very well say, hey, can you all meet on Monday so that we can approve this contract? Because what we don't want to do is, one, there's not enough capacity for them to do what Reggie did as a contracted person. And with the legislative session going on with the trial of Derek Chauvin, which, you know, I hate when people say, yeah, the George Floyd trial. I'm like, George Floyd's not on trial, it's Derek Chauvin. So, you know, so with that trial going on and other aspects, you know, the vaccinations, I mean, there's just so much that we need to have somebody in place. So I'm just really kind of putting you all on notice that if you all get something that says, hey, availability, we're having this, we need to move on it. And we do need a quorum in order to, you know, vote when that time comes. So it's Tuesday, you all could get a notice as soon as tomorrow to say, hey, we're going to meet, you know, like I said, we give you all publicly, we have to announce it within 3 days. And so that's where I'm just kind of putting you all on notice, because I don't know what schedules are like, you know, but just keep in mind that there could be something where we're asking you all to come back together to go through and vote so that we can have somebody replace him.
Thank you, Madam Chair. The other and the last piece of this too is we are getting a lot more requests from the legislators to support them with letters to different committee chairs for hearings. And so we've been kind of fielding that, primarily Theo, but we've been kind of fielding that. But it's a lot. I mean, because you got to do the research, you got to understand the background, and then you got to write the letter. And so it's not, it's not a good place to be. So we really need to have somebody on board as quickly as possible. So thank you.
Questions before we move on to other items?
Quickly to add, and I'm sure because we do have the budget to do that, so I definitely support that happening. Belinda, you talked about, when you talked about the branding, I think one of the things that came up was also is that will be part of sort of a public relations and utilizing the Black media type thing as well, right?
Yeah, yes, it would be comprehensive. So Black media would be included, and we would make sure that it's not just African American media, it needs to be African heritage, African immigrant media as well. Right. So whatever we do, we will be making sure that we're looking at it from both sides of the house. So just be assured of that.
Thanks.
Mm-hmm.
Madam Chair, I have a suggestion. For a situation like this, when we do contract with them, we can give them they should give us 30 days notice if they are going to walk away from the contract, and we can also do the same with them. I think that's standard. So if we have a situation like this, that 30 days will help us to be able to get things in place, especially with this critical situation. We need somebody to be working daily.
Yeah, and normally that would, there is some type of communication that happens, but this was a family emergency. So you can't control that. Okay. So this was not just all of a sudden, I can't do this. It was a family emergency that this came up.
Okay.
But still duly noted what you're saying, because yes, there typically is conversation that happens prior to that. But this was the one-off, I would say.
So that is it for the director's report.
All right, any other questions for Linda? Otherwise, Theo, I believe you are up.
All right. Thank you, Madam Chair. Madam Chair, Mr. Vice Chair, members, the look of the legislative work in February focused on three key areas, three priority areas for us, policies that seek to strengthen African heritage families and communities, legislation that advances economic and educational equity by seeking to close achievement and opportunity gaps, and also public initiatives that are related to the statewide movements and efforts for police reform. So I'll just go through some of the legislation that we have worked on, particularly in February for this update here. So I mean, the first major one is a bill that the council has been supporting for a number of years, HF House File 1151, which is the African American Family Preservation Act. This bill is authored by Representative S. J. in the House and Senator Champion in the Senate. And just yesterday, actually, the bill was voted out of the House Judiciary Committee, and it would receive a hearing in the Human Services Committee on Friday. And so actually, this is really important here. We've sent out action alerts asking community members and organizations to submit written testimonies and also to call their representatives to urge them to support the bill. And I just want to urge all of us here, I mean, all our council members, I mean, to
to share this with your networks, just for us to get and mobilize community support and action around this particular piece of legislation. I mean, all the legislation really that are priorities for us, but in particular, just the urgency of this one this week and moving forward in the process here for the session. Another key bill is House File 784, which is also called sometimes the Philando Castile bill. This is a bill that's authored by Representative Thompson in the House and Senator Fateh in the Senate. The main headline here, the bill seeks to combat systemic racism by addressing the problem of underinvestment in the African heritage community and its youth. A very, very important, just comprehensive legislation focusing on developing and establishing financial and technical supports for our community across a range of dimensions and domains. We sent a letter of support for this bill, and it did pass in its first hearing, and was sent to the Judiciary Committee. So that's where we're waiting now for a schedule, for it to get on the schedule of that committee for another hearing. The third bill was one that is authored by Representative Ruth Richardson, House File 952. This is the Task Force on Missing and Murdered African American Women. This bill will create an inquiry task force to investigate and bring greater understanding around the issue of violence against women of African heritage in Minnesota. We sent a letter of support for this bill, and it did pass its first committee hearing and has been sent to the Ways and Means Committee in the House. And I think it's a very, very important piece of legislation in terms of bringing awareness on that issue and really trying to deal with some very intricate problems regarding law enforcement and just the culture of violence that we're burdened with. Another key piece of legislation is actually a bipartisan initiative to increase teachers of color in the state of Minnesota. And so this is the Increased Teachers of Color Act, or ITCA bill, legislation that's composed of two component bills, each with its own versions in the House and Senate. There's the elementary school through 12th grade components of the bill, and also a higher ed component. And in terms of our own support for legislation, I mean, we've supported the act through 4 very strong committee hearings in the House and the Senate in the month of February. And we also participated, as Linda was saying, that we participated in a bipartisan press conference on February 25th. A key thing about this legislation in terms of the bipartisanship and in terms of its success, I think right now at this stage, it's been more successful than at every other year in terms of how far it's moved along the legislative process at this time of the legislative process compared to other years. So the bill is supported by the Posse Caucus, so People of Color and Indigenous Caucus, and it's endorsed by more than 50 organizations throughout the state of Minnesota. And the next steps here would be for further hearings in the Education Finance Committees and hopefully floor votes. So we will have more updates. There's definitely a lot of movement around that piece of legislation. And finally, another key component that I want to give you guys an update on is the initiative that we have worked on around First Amendment standards for public assembly response. The Derek Chauvin trial began yesterday, right? I think it began yesterday. I mean, our state has the dual responsibility of preserving public safety, but also protecting civil liberties. And so, I mean, a major issue for us, particularly with this trial, is how the state goes about managing that responsibility. Governor Walz proposed the creation of a $35 million fund to help bolster security during the trial. And the bill passed through committee in the House
with an important amendment by Chair Mariani that seeks to bolster accountability for First Amendment rights of peaceful protesters and bystanders. So, I mean, if to tie funding, increase funding for security and policing, also to increase measures for civil liberties protection. The amended bill did not pass in the full House, and there are different views within our African heritage community about proposals to increase police funding, but there's definitely consensus in the community about the need for measures that improve police standards of conduct and accountability for those improved standards. And so as a council, we worked with community partners to petition the Post Board to act immediately to establish a minimum First Amendment standard for public assembly response. The Post Board is a state agency that serves as a licensing board for law enforcement and oversees standard of conduct rules for our peace officers and for law enforcement agencies. So we sent letters to the Post Board Advisory Council in February, and we also organized community testimonies at a special meeting that was held in March 1st. And through these efforts, the Advisory Council voted and passed policy language for a First Amendment standard that should be forwarded to the full Post Board to pass into rule. And so that is still a work in progress. We definitely will have further updates on that, but there's a lot of movement in that arena regarding community concerns about and initiatives around police reform. So thank you, Madam Chair. That concludes my report.
And so the House file that you're talking about you're talking about the one that that Cedric Frazier put forth? I think it's House File 1374, because I know that there's a hearing that around that. There's a hearing, and this is around the exactly the chief law enforcement officer, for peace officer misconduct data.
Yes.
Boards, and so that is this Thursday at 1.
Yes, so that's another piece of legislation.
Yeah, thank you.
Yeah, that's another piece of legislation that is a very important component of this this sort of broader strategy that is very community-led, community-centered for police reform. So that's another component of another leg of the work ahead for police reform here.
Perfect.
Yep.
Thank you. Any questions for Theo? And keep in mind, like we said before, if there are certain areas where this is kind of your expertise and you want to testify, absolutely, I think it's advantageous for us to testify, whether you're testifying with using both hats, testifying on behalf of your organization and as a council member, and I think about more specifically when I think about the teacher of color bill. That is something that we've been talking about. The one thing that, I hope that this time we kind of move the needle, so to speak, on that, because we know that it's proven, it's evidence-based practices that students do better when they can identify and when they have that sense of belonging with somebody that looks like them. We're seeing it at higher ed. Higher ed is just now getting to the point where they're really disaggregating it and really seeing where the disparities are. So I'm gonna get off of that soapbox, but I just wanted to throw that out there too, because we do need to be thinking about that. Andre, were you gonna say something?
You're cracking me up today. I have been working with Representative J and to on this Friday on House 1151, and so I'm also going to be working with the champions, and so I've made a decision to kind of step up and really drive some support around that. So I just wanted to note that.
Thank you for that. Others, before we pass it on to Amber. All right, thanks, Theo. Great work. Amber, you are up.
All right, I'm going to be brief. The majority of last month was really focusing on Day on the Hill. So just thank you again to the team. Thank you to the board. Thank you again, Reggie, for all the support, whether it was, tuning in, helping with the production of the content, all of that good stuff. So we just thank you for that. Other outreach or legislative activities, outside of just ongoing activities that I'm always doing, certain committees and work groups and calls. I did testify for HF 593, which was the white supremacy bill that Representative Frazier has authored. So I did testify for that bill, and it did pass out of the Public Safety Committee. So it will be going to the House floor. In the same vein around just like white supremacy and policing, the Justice Research Center just released a report on trust in policing and white supremacy. And I did advise on the final drafts of that report. Also presented last month at the NAACP Minneapolis branch meeting. I also presented at the state's Black Justice ERG, which is a new employee resource group for Black employees at the state. So I presented at their meeting for Black History Month, and that went really well. It was a lot of great conversations. There's also been a series called Time of Reckoning Short. There's a longer name, but I don't have that in my notes. But it is a convening that's been facilitated by a set of Black leaders and facilitators across generation. And the Department of Human Rights is like a supporter of that event. So I attended their second forum, like congressional style hearings. And so it came out of, the murder of George Floyd. And so that's going to culminate into a report after, I think they may have 3 more events throughout the rest of this year. I also attended an African American leadership constituency meeting with Representative Ilhan Omar. And I know she's going to keep convening us over time as a group of Black leadership within her district. And then also I was supporting strategy for the Crown Act, the First Amendment standards, also now with African American Family Preservation Act, just being able to support where I can on the legislative strategies, especially as we're going into March where there's deadlines coming up for different bills to be heard. One deadline's this Friday, the next Friday, and so we're reaching the midpoint of the legislative session, so a lot of outreach is increasing. And then looking into the upcoming months, just really trying to prioritize outreach during the trial, being able to signal boost Black media outlets. I know that was mentioned earlier on in the meeting, but being able to signal boost Black media outlets who are covering, yes. No, it wasn't Reckoning the Rise. I know that series. I was with CEI. It was it's like Time of Reckoning, Healing, and something. I'm sorry. Sorry for butchering the name. But the 2 leads on this project are Dr. Joy Lewis and Dr. Brittany Lewis. So those are 2 leads. But yeah, as I was saying, as the trial has started, just really signal boosting independent Black media outlets who are covering the trial and just making sure that we're giving, we're amplifying those voices and just staying in connection with community partners. There's been a lot of frustration and kind of re-traumatizing this past about month and a half, as a lot of the plans, like I'll just be real for the live feed, but as the plans for like Operation Safety Net have been rolled out to the public, it feels like for a lot of community members, there is a disproportionate emphasis on the law enforcement response and not enough emphasis being put on the community's needs and making sure a community has access to resources to cope with the trauma that they have been enduring since last May and even before that. And so as a council, we are not just aware, we are trying to utilize our positioning at the state to be, when we're in conversations with different departments, with different officials, to be able to elevate that, to be able to advocate for more resources, to be disseminated out to the community so that they're able to care for themselves and each other in this process as well. Obviously, we're at the state level, so we have like a limited influence. A lot of those decisions are being made on the local level about how to move forward in certain aspects. But being able to just work with community partners, other government officials on different levels and so on. And just if there's anything that you are seeing in community, any resources that we can signal boost so people can have access to those resources, please let me know so that we can get those on our social media outlets, and also people that you think we should connect with. That's all I got.
She's like, one and done. Any questions? Any questions for Amber? Lots of good information. And I don't know about you all, but you probably have seen there's been several organizations that have been putting on series of just various topical information. And that's, you know, that just to kind of give you an idea of what we're talking about doing in June, very similar. But really focused in and honed in on leveraging and maximizing the relationship between African immigrants and African Americans. So we too will kind of, and I'm not going to say we're going to jump on that bandwagon, but that'll be something different and out of the box. I know Amber did, that was like this summer, Amber, was it, when you kind of did some panel series around different topics where we had discussion and other topics, but it was more specific around those areas. And now this one will be something a little bit different, but that's what's basically to come. So further information to come about that, but we'll kick it off in June, you know, with a couple of panel members from African American leaders and African immigrant leaders. Any other, are there any announcements for the good of the meeting? If not, oh, were you gonna say something, Linda? You're muted.
I'm not sure if Shakira had anything that she needed.
Shakira, oh my God, Shakira, I'm so sorry. I always forget you. Not on purpose. Did you have?
It's okay. The only thing that I had was just that the directive that we're getting from higher ups in government is that we will be working from home through the end of the fiscal year. They are looking at having us go back to the office in the summer, so around July, but that is pending vaccination percentages.
Thank you. And we just talked about that too. So, and that's a good, it's a good dovetail to the conversation that we probably need to have, and maybe we won't have it in April, but for sure, like maybe May or June. What will this look like for the remainder of the actual calendar year? Will we continue our meetings like this, or will we end up, you know, being face to face? And so I think the executive council team will have that discussion, but I think let's have it in June, because hopefully by then we'll have a better gauge of what July, August, you know, through December will look like. And it may be a combination, you know, but I think it's worthy of a conversation right now, because the last time we said, yep, we're going to go forward and have everything virtual, and that was last year. We may end up, you know, saying the same thing for the sake of, you know, because the unknown, we may say for the remainder of this year, 2021, we will remain virtual. But I want to have that discussion. And really, you know, if anybody has any thoughts right now, you know, please share them. Otherwise, we will have a further dialogue in a couple months.
I think we should look at, I mean, would be my opinion to look at, start having that conversation soon. And June would be a good time to start. That would give us a good gauge of whether we all can come back together, all vaccinated and all that, and
Right.
again. Okay.
Thanks, Wayne.
All right.
And yes, I see a message from Carl. Yes, absolutely. Continue to keep our Attorney General and many others in our prayers. Especially, during this trial, because what I shared with a couple of friends is, the unfortunate thing is what this is doing for some people, it's reliving trauma. We know how historical trauma is, but this is reliving that trauma all over again. So we just have to just remain somewhat optimistic as much as we can and positive. So with that, it is 7:58, and I would love to entertain a motion to adjourn.
So moved. This is Dukes.
All right, is there a second?
Second.
All right, all in favor, we are adjourned.
All right.
Thank you. You guys have a